It's a huge pleasure and an honor to be able to give this lecture at the 5th anniversary of the founding of the Harvard Data Science Initiative. And I remember talking to Jolie right at the beginning on this and the plans for it and how exciting they were. And of course, you know, the subsequent events have shown the enormous importance of these ideas that we're going to be talking about for the next hour and a bit. Okay, so I'm going to start by sharing my screen and giving a talk, and then we're going to try to answer some questions and have a discussion with Zoe, which would be great. Okay, so I'm going to hope to share my screen now. Oh, hang on, let me just get into full screen mode there. So I want to get going here. Sorry, this incompetence. I'm usually a bit more slick at doing this stuff. Okay, right, here we go. So should we trust statistics about COVID is what I'm going to talk about. Jolie mentioned, I'm no longer Winton Professor for the Public Understanding of Risk because I've formally retired, but I'm now got an even worse title, Chair of the Winton Center for Risk and Evidence Communication. And I'm going to be talking about communication. This is the thing I've become rather obsessed by. But just to mention, I don't think it's a conflict of interest, but over the pandemic, I've been appointed as a non-executive director of the UK Statistics Authority, which is the body that oversees national statistics in the UK. And so I'm going to say nice things about them, but of course I wouldn't I? Okay, so I used a bit of background. I used to do statistical methodology and write books on artificial intelligence and probability and Bayesian approaches to clinical trials and Bayesian analysis using Markov chain Monte Carlo and all that kind of stuff, quite technical, some fairly technical things. And that's what I did. I was an academic and I really enjoyed it. But, to be honest, about 15 years ago, I was thinking, I need to, at the end of my career, I need to do something a bit different, I think. And then I was very fortunate to be philanthropically funded in 2007 by a hedge fund manager, David Harding. It's always good to have a friendly billionaire who likes to give money to mathematical causes. I really recommend finding one. And he appointed me as Winton Professor for the public. Oh, no, he gave the money, endowed the chair. He had no say in the appointment for the Winton Professor for the Public Understanding of Risk. And that enabled me to kind of become a more performing statistician, making BBC4 documentaries. We're very fortunate for the BBC, where they have scientific documentaries that are fronted by academics rather than celebrities, but also then developing a media profile. Here I'm on CNN talking to Anna on Anandpur, and this has been very exciting. And Reese, over the last few years, he's given us more money. So now we've got a large team of people. These are the Winton Center for Risk and Evidence Communication. These are mainly psychologists, communication professionals, web designers, and we've been incredibly busy over COVID working on the appropriate ways to communicate in a trustworthy way. And we'll come on to that later, what that actually might mean in practice. As Jolie made, I got this book, which has done very well. Nothing like a pandemic to sell statistics books. I think, always look on the bright side of events. I started the book really with a quote from Nate Silver from his excellent book, The Signal and the Noise, where he said, I think a great quote, "The numbers have no way of speaking for themselves. We imbue them with meaning. We speak for them." And that is so important, because that's why I call the book The Art of Statistics. Even if you got, as Zoe has talked about, the big data paradox, the more you get, it can make things worse if you don't understand the possible biases and the problems with the data that you've got. Just having lots of the stuff can only make things worse if you don't really understand what you can learn and what you can't learn from the data. And that requires judgment. I think it is an art. I think it's learned very largely by apprenticeship rather than, which might make it, of course, more like a vocation or something like that. So I think this is terribly important. And it's been very obvious during COVID how important that judgment is. So the other thing is, I've got a new book out, COVID by Numbers, Making Sense of the Pandemic with Data, which again is doing pretty well. It's nice to do that. And partly because it's all about stats, we're trying to put in a lot of interesting little bits and pieces. So for example, here's we put in surprising fact. Here's a surprising fact. In the UK, the pandemic has been a net lifesaver for younger people. It's saved more lives than it's killed, essentially. So if you look in 2020 in the UK of people aged between 15 and 29, there are over 300 fewer deaths than the average over the last 5 years. So there's been a deficit in deaths. And there were also 115 deaths involving COVID-19. So actually, it looks like if you take away the COVID, there's 400 fewer deaths from other causes. So this is amazing lifesaver. And of course, it's because there's a huge reduction in accidents and violence due to so many young people just being constrained in their homes for such a long time. It's not saying this is a good thing to lock young people up, even if it does save lives, because of the damage to education and mental health and so on that we know is happening. But if we just essentially just count the number of deaths, more lives have been saved by the pandemic than have been lost for it in younger people. So basically, though, it's been a very busy time as a statistician in this pandemic. I would say that I think the national statistics organizations in the UK have done a very good job. I've got to know them. They really churn incredibly agile, rapid development in methods, and which I'll talk about in a moment. For me, who's had a lot of time dealing with the media, it's been quite a challenging time. Huge demand from the media for comments from experts. And we're very lucky in the UK to have this thing called the Science Media Centre that puts scientists in touch with journalists. And we get the new papers under embargo before they're made public, so we can see them and comment on them as part of the news cycle when the journalists have seen them. And most journalists have acted very well. I've only been stitched up a couple of times, I suppose, but I still constantly have to deal with I was doing an interview yesterday, and it's always, what do you think is going to happen with the Omicron variant? What's going to happen after Christmas? Are we going to have to cancel Christmas parties? So it's constantly being asked to speculate, to comment on policy, and then the skill I've had to develop, and everybody else, is to be able to say, I don't know, it's not what I do, that's not what I talk about, let's stick to the data. And there's very little data about Omicron at the moment, so I can't say too much. Okay, and Kevin McConway and I, in Significance, have written a whole article on being a statistician communicating with the media, with #1 recommendation: sound human, which is easier said than done, I think, and steer clear of jargon, etc. So I'm not going to go through all these, but this is a great list of stuff that we've picked up in our experience. Stick to explaining, keep off the jargon, be careful, don't never have just a chat with a journalist unless you absolutely trust them, because they'll lift out the one thing you don't want them to report. And finally, the thing, you'll get things wrong. Don't agonize about that. I get things wrong all the time. Last week on Sky News, I was on a Zoom and I accidentally touched something and I muted myself. So I started a live interview on Sky News. I don't know how many people watching, like that, muted. What an idiot. Anyway, so it happens. Okay, the other thing we've had quite an advantage in doing is that with Anthony Masters, who's a Royal Statistical Society ambassador, he's half my age, less than half my age, but we started the scheme in the Royal Statistical Society of having ambassadors, younger people, trained up, given some media training, and encouraged to get out there and communicate. And he's done it brilliantly. And now we wrote this book together, and that arose out of these articles that we get published in the Observer, one of the main Sunday papers, every Sunday in print. They go online afterwards. And we've done 47 of these. We're desperate to stop. And but apparently they're popular. And we're just like 350 words on a statistical topic. Have you tried writing anything in 350 words? I mean, it's more than twice as difficult as having 700 words. It is incredibly difficult. But we do it, we did Omicron last week, did meta-analysis the week before, boosters the week before that. And so it's a real challenge. We've just chosen what to do last week. On Tuesday, we decide what to do. So that's been a feature of this year. And I'll come on to some of our examples later. Let's look at some data when we can start getting onto the presentation of the data. This is the dashboard we get in the UK every day, updated at 4 o'clock. Oh, sorry, I only updated it yesterday. So this is, look at this, is the basic statistics, and we can drill down and find out all masses of stuff one can download, etc. But basically, it shows we're in this slightly interesting situation of the number of cases going up, but deaths and admissions to hospital are still going down. So we're in a very curious state at the moment. Cases in older people are going down, cases in younger people are going up. So this is the main graph that comes out of the Office for National Statistics, which is, I'm on their board, every week, showing death registrations in the country. I think this is really quite nice communication. The first thing is the main message is in the graph, is in the title. Total deaths from all causes were above the 5-year average in week 47. So the black line is the 5-year average. The blue are deaths with COVID on the death certificate, not necessarily caused by COVID, but 90% are caused by COVID. And green are other deaths. And it bumps up and down because of these, which is pointed out on the graph, some explanation there about it's going up and down because these are registrations. And if there's a national holiday, the office is closed and you can't register, so there's a dip. I mean, it's an amazing story, this graph. I mean, I hope you can see my cursor. The first wave, you double the normal number of deaths, expected number of deaths, with an excess of non-COVID deaths as well. These were COVID deaths. I think everyone agrees. Older people weren't being tested. They were dying. They weren't being seen by a doctor to complete the death certificate. These were COVID deaths. So our COVID deaths is an undercount at this point. Second wave, totally different pattern, a deficit in non-COVID deaths. So non-COVID deaths running way below normal. Okay, what's that? No flu. Probably one of the major issues that all the measures just eliminated flu, and it's doing so again this winter. We're not getting flu this winter either, not quite to the same extent as last winter, but very, very low flu levels. But also, some of the people who would have died here. Deaths were brought forward by 9 months. What's called mortality displacement, or this unfortunate term harvesting, which is one of the words I try not to use on the media. Then we've had, again, a deficit of non-COVID deaths due to mortality displacement here. Interesting what's happening at the moment. There's a lot of, the baseline to calculate excess deaths here, just using 5-year average. Well, things have changed just since 2015 to 2019. The population's got a bit older. If you use a more subtle baseline, which the actuaries report each week after this comes out, it turns out that there's no excess non-COVID deaths at the moment. There's more COVID deaths than there are excess deaths. So there's a deficit in non-COVID deaths at the moment. Again, which is interesting, and I think explainable very much by flu or lack of flu. The numbers just always generate more questions. If we look at where people are dying, the excess, where people are dying, it's gone up and down in hospitals and care homes. But down here in this corner, again, look at the graphs using small multiples, which become, we can see loads of those now being used in for communicating COVID stats nationally. And again, with the main conclusion in the title, so you can't separate it. The graphic stands on its own pretty well. So I think is good, very good practice. But a huge excess in deaths at home. These are not COVID deaths on the whole, very few COVID deaths, because people haven't been going to hospital to die. They've been dying of cancer and heart disease at home rather than in hospital. So these aren't extra deaths. They're deaths that would normally happen in hospital. So this raises all sorts of issues that this data can't answer, such as, is this a good thing? This is a systematic change of where people are dying at home, are dying in the UK. Massive change. Is it a good thing? Most people would prefer to die at home. We don't know. We don't know what the quality of these deaths are. It's become a little personal obsession of mine that we don't have good data on quality of death. We've got a lot of data on quality of life. We don't have data on quality of death. And I think it's something that is terribly important. Okay, so we're also very fortunate, and this will resonate with Zhao Li with his recent Nature paper, of having an actual infection survey being done. we're not just reliant on case reporting and who decides to go for testing or whatever like that. The Office for National Statistics stepped in extremely rapidly in April 2020 and adapted one of its existing surveys to go out there and do PCR tests on tens of thousands of people every week. Conflict of interest, I am now the chair of the advisory board for this survey, but it's been enormously important and had huge policy implications. This is the latest data on proportion testing positive in the population, estimated with credible intervals. Notice credible intervals, Bayesian modeling through all of this being done. So showing the low rates in older people through the vaccine, and very high rates that have been in school years. School 7 to 11 is sort of aged 11 to 15 or so, but has now dropped considerably. Well, and who knows what's going to happen with Omicron. Okay, so surveys are a fantastic thing. Okay, I've shown you some pretty good stuff, to be honest. Let's look at some pretty bad stuff. What I'd like to emphasize the fact that the media have got some terrible stories, but so often they're due to the poor reporting of the statistics in the first place. These could largely have been avoided. Okay, some recent bad stats. Here we are, one from last month, Evening Standard. UK COVID deaths soar to 262. And so the COVID deaths climbed to 262 in the UK on Tuesday. But by comparison, there were 57 deaths reported on Monday. So what's happened? The point is that, the deaths, we know that Tuesday, there's always a huge spike, always. And on Sunday and Monday, you get very low numbers of deaths because people are not reporting the deaths on Sundays, on Saturday, weekends from hospitals. Some are, mostly not, and they all come in on Tuesday and Wednesday, or reported for Tuesday and Wednesday, go in the Tuesday and Wednesday data. So this is absurd, completely absurd. And in the book, we've got this nice graph showing that if you look at if you are monitoring according what was said on Wednesday, you get a totally different picture of what's happened to if you are monitoring according to what was said on Sunday. So, everybody should have learned this after a year and a half of the COVID, that the day of the week is important. You can't interpret the days of the week and compare it with the day before. Evening Standard is still doing that. There's been 3 headlines where they said numbers soar. They use the same term. It just makes you want to bang your head against the wall. It's just hopeless. Okay, here we are. Chief Executive of NHS England saying we've had 14 times the number of people with COVID in hospital than we saw this time last year, on the 8th of November. So that got a lot of coverage. It was completely wrong, totally wrong. That's the data showing how many people were in hospital at each time. Now, it was 14 times back in August. There were more people in hospital in 2021 than in 2020. That's because the government pretty well stopped all restrictions then. And since then, levels have been high throughout the whole summer. We've had very high levels of COVID, which of course has given a lot of immunity in the population, to be honest. We got our Delta wave over, in the summer. By now, though, there's more people in hospital in 2020 than there are in 2021. So she got it not completely the wrong way around. So that was pretty bad. Okay, Susan Hopkins, again, medical advisor of the UK Health Security Agencies. We're still seeing deaths in mainly the unvaccinated population, but increasingly because of immune waning effects, there are deaths in the vaccinated group as well. This is completely wrong. The majority of deaths for months have been in vaccinated group. Most of the COVID deaths in the country for months have been in people who have been vaccinated. So this was back in June, and it shows, I don't want to go through the table in detail, but basically the number of deaths in not vaccinated is far lower for everyone over 50 than the number of deaths in the vaccinated group. Okay, we tried to explain this back in June, wrote a whole article, why most people who now die with COVID in England have had a vaccination. is not a bad sign. It's exactly what you'd expect from an effective but imperfect jab. So this was, okay, so the reasoning is, nearly everybody at high risk had been vaccinated. The vaccine isn't perfect, even if it reduces your risk by 95%. Still, there's some breakthroughs, and those outnumber the number of deaths in the far fewer unvaccinated people. We use the seatbelt analogy, that most people wear seatbelts. Most people who die in car accidents are wearing seatbelts. It doesn't mean they don't work. It just means that most people wear seatbelts and they're not completely perfect. This was I just want to illustrate what can happen when you do, take up a certain profile. This was a great tweet we got. David Spiegelhalter, Anthony Masters, and the entire lying, genocidal editorial board of The Guardian should be hunted down and destroyed for crimes against humanity, period. So we don't usually get that much. We do get a fair amount of abuse. I think I have got fairly used to it. And I'm lucky, I'm a white man. I don't get the really nasty stuff. So, but we get, this was the threat. And this guy I presume it was a guy, got banned from Twitter for making threats. But I was stimulated, but I was quite upset by this. But Anthony was great. He decided to respond as a joke. He said, I thought that seems harsh. I thought it was a good article. So I joined in. Oh yeah, perhaps that's a bit harsh, but I've had worse referees reports. And that started a whole chain of tweets of people, imaginary referees reports saying referee 2 thinks you're genocidal and should be destroyed. I therefore invite substantial revisions to your paper, and so on. Anyway, so we managed to get rid of that, but we still get a fair amount of abuse. But then what happened in September 2021, I think it was even worse, is that now this is cases by vaccination status. And I don't want to go through that table. This is a bit of that table. Okay, so this is age groups 40 to 49 up to 70 to 79. The number of cases in unvaccinated people, the number of cases in fully vaccinated people. Okay, so most cases are in fully vaccinated people. That's fine. It's exactly the same argument as the deaths. It doesn't mean the vaccines don't work. It's just that there's a lot of breakthrough cases. And here's the seatbelt analogy. It doesn't mean they don't help. It just means that nearly everyone wears a seatbelt. So that's fine. So that's we can deal with that argument. Well, we hope we can deal with that argument. But the agency, which was then called Public Health England, put this graph in. Now, this is about the rates in vaccinated and unvaccinated people. So it's not just the total count, because we know that's that's wrong. These are the actual rates per 100,000. So the seatbelt analogy goes away. And what this shows, and they drew an actual graph of that, is that the actual rates in the vaccinated group were higher than in the unvaccinated group in this range. Oh my God, what's going on? Can't use the seatbelt argument. This is really difficult. What's going on here? And this got picked up by a major political journalist, Robert Peston, who tweeted this out. It went viral. He took the tweet down, he withdrew it, but by that time it had gone viral. It was picked up by anti-vaxxers. It went around the world. Okay, so the basic, what's gone wrong here? The basic problem is, and this is, I think, a really interesting data science issue of just to do with the reliability of the data source can totally drive the conclusions. We don't know how many people are in the country. That's the basic problem. We don't know. Let's look at people aged 40 to 49. If we count the number of people registered with NHS doctors, it comes to 8.1 million. But if we use the Office for National Statistics estimates, based on the census 10 years ago with revisions for births and deaths and migration, it comes to 7.1 million. It's a massive difference. And that's because we know that there's more people registered with the health service that exist in the country, because people are registered in 2 different places, like students. Other people have just left the country. And so that 8.1 million is an overestimate. 7.1 million is possibly an underestimate because of migration. Okay, so we don't know how many people, and this is a huge difference. But we know that 6.4 million have been fully vaccinated. And this is where it gets really difficult. When we subtract that known number from the unknown number, we end up with a difference the size of the unvaccinated population, which has got huge uncertainty. Is it 1.7 million or 0.7 million? You know, there's a massive difference. And the point is that those data that I showed were based on the medical records denominators, the wrong denominators, really. And if you use the ONS denominators, the numbers come out as being fine, very sensible. So this was disastrous and made doubly disastrous by the agency that produced these numbers refusing to change their methodology. They did take the graph out, but they kept on producing those tables week after week. They refused. Articles were written, complaints were made. They wouldn't change their methodology. So we wrote another article about this. You know, this is pretty bad. You know, they shouldn't have published it, I don't believe. Just giving some caveats is not enough. They either have to do it with both sets of data or not publish it. But a big argument there went on, fed international conspiracy theories, and the final straw was when a video went out showing President Bolsonaro of Brazil using this data. There it is, there he is holding it up to support his claims that COVID vaccines spread AIDS. And you think, oh my God, this is just awful what's happened here. And that was in October. And the problem had been pointed out way before that. So this is disastrous. And actually, what's interesting is that I'm on the committee that looks at examines the work of the Office for Statistics Regulation, which are the statistics regulators. They're the statistical police in the UK, and they can tell off and write official public letters to politicians. They've written them to Boris Johnson, written to everybody when they misuse statistics. And they wrote one to the head of the chief executive of the UK Health Security Agency for this use of data. So this was a pretty big telling off, because they just stuck to it. They wouldn't change their minds, their methodology. So this was a real disaster in terms of statistical communication. And so this got some publicity. UK Statistics Watchdog scolds replacement body for publishing misleading figures, which anti-vaxxers have seized as proof that COVID jabs don't work. So, you know, it just shows what can happen with bad stats communication. Okay, just to finish off, I want to talk about trust. I always talk about trust. And I should say that if you want to know anything about trust, I don't really like TED Talks much, but this is a real cracker. This is Onora Neal. She's a philosopher, you know, little woman, terrifying. She's great. She does this 9-minute TED Talk on trust, and which she brings in, you know, she's got jokes, she's got Kant in, because she's a philosopher of Kant, and it's brilliant. You know, it's full of great nuggets. And one of her nuggets is this, which I use all the time in every talk to every organization. Organizations should not be aiming to increase trust. Everyone says, oh, we want to be trusted. We're wonderful. Why don't people trust? We want to be trusted. She says that's completely wrong. She's a philosopher of Kant, which is to do with, I've never read any Kant, but I understand it's to do with duty ethics, that you have a duty to do certain things. So she says there's a duty to demonstrate trustworthiness. The onus is on you as the communicator to be trustworthy. And then people may trust you, but they shouldn't if you're not trustworthy. So this trying to be trusted is they're getting it the wrong way around. You should be trying to demonstrate trustworthiness. This has had a huge influence on our work in our centre, but also on the UK statistics system. The Code of Practice for Statistics, which the UK Statistics Authority, as I said, I'm on their board, produce, and which regulates the use of statistics in the UK, has 3 pillars: quality, value, but number 1 pillar is trustworthiness. That statistics should be trustworthy. And then it sort of sets out what that means. And that's what is used to identify the misuse of statistics in the country. It's extraordinarily important. Okay, and so I've been on, this is my one viral YouTube video, 1.7 million views, because I was on the main political talk show on BBC last year, when I don't usually criticize the government, I avoid that, but I absolutely laid into them for their brief press briefings, where they were just using statistics just as rhetorical devices, pulling out lots of big numbers. And I said, this is not trustworthy communication of statistics. Actually, I did use the term number. It was just number theatre, and that got a lot of resonance. That became very popular as a phrase. Okay, so we in the Winton Centre, we had this nice comment piece in Nature where we tried to summarise what we felt were important issues around trustworthy communication. And the number one is that, which we follow, is that really you should be trying to inform rather than persuade people. Or at least if you are trying to persuade people, be honest to yourself and them that that's what you're trying to do. So you should be trying to empower people to make better decisions by giving them by improving their understanding of the issues. And that's trustworthy. And that requires balance, not false balance. It doesn't mean that everything's the same. Some things are hugely more beneficial than harmful, but you need balance, benefits and harms, winners and losers. You've got to be upfront about the uncertainties, what you don't know, and about when your evidence isn't good quality. And the one that's quite interesting is about, you should also, I think, just go in there hard and try to pre-bunk the misinformation. Get in there and hit the misinformation hard. Don't allow it to brew. Don't be on the back foot to respond to it. Get in there and hit it hard. Okay, so we had an opportunity to put this into practice back in April when which is very much a European UK problem about the AstraZeneca vaccine, being associated with some very nasty blood clots, which appeared largely in the brain in younger people. A lot of anxiety, a lot of sort of fear going around Europe about that. And so we got the data, under embargo on the latest cases and things like that. And we're asked to produce some graphics to help. And then they ended up being used by Jonathan Van Tam, who's one of the most deputy chief medical officer, hugely trusted figure. He's become one of the great, a hugely trusted spokesman. And he did a briefing on 7th of April, announcing that the AstraZeneca vaccine was actually no longer going to be recommended for young people. And he used our graphics. So this is what he was using. These are quite complicated. And when we sent them in, we thought they'd help the discussion. We didn't expect them to actually be used live on a major TV program, because they're really quite complicated. But he took the audience through it slowly, really went through it in detail, and people loved it. They became enormously popular. So basically, we had 3 of these in different situations: low exposure risk, medium, and high. So this is low exposure risk, which is not what we're in at the moment in the UK. We're in pretty high exposure risk. So, and what we're trying to do is show the benefits and harms. The harms were these serious blood clots, and which the risk increases as you get younger. So the risk for people my age, risk is very low, 1 in 5, 1.5 million. So, et cetera, et cetera. This is we fitted a Poisson regression to the rates. For the benefits, we tried to choose something that was roughly comparable, and we decided that preventing admission to intensive care, and this goes up hugely as you get older. The massive increase in benefits. So for people my age, the risk-benefit balance is pretty damn obvious. But look at the under 30s, and so that gave a very good graphical reason why the line was going to be drawn here, and later the line was drawn at 40s. So this design was then copied by European Medicines Agency and all sorts of other people. It was translated into Spanish and French and Italian and all that kind of thing. So that was us trying to put into practice some of our principles. There's no uncertainty on there. We could have blurred the blobs, you might want to say, but actually we don't think we could have added anything in there. The thing we thought we wish we had added in was which we added in later, was a little comment saying there are other benefits and harms. For example, the benefits to other people of being vaccinated and so on. So this is just because, in a way, I think in every graphic should contain at least a mention of what isn't in the graphic, but is also important. Okay, so Honora Neal, just to finish off some final little sound bites from Honora Neal. this is stuff I push all the time. It actually is in that Our Trustworthiness of Algorithms paper. I'm sure I put it in there. I waste no opportunity in promoting her ideas about transparency and openness, about data and about information, because this is a really good list, I think, that I use all the time in my work. That if you're communicating data, it's got to be accessible. People have got to be able to find it. That's not so difficult now, but it can't be buried in some huge PDF. It's got to be intelligible. People have got to understand it. You should check that. That's why I love working with psychologists, because they check it, that people can actually understand what's going on. It's got to be usable. This is also one I like. This is one that it means it actually addresses the concerns of your audiences. Even if they're not your concerns, even if you think they're slightly misguided, it tries to answer their questions, taking the audience seriously, treating them with respect, listening to them. First rule of communication is to shut up and listen to your audience. And the final one, which I think is desperately important, is it's got to be accessible. You've got to, somebody should be able to check you're working if they want to. You've got to be able to drill down. No, most people won't want to. But you've got to be able to, somebody should be able to drill down and find out where you got your claims from. Okay, so it's accessible, intelligible, usable, accessible. March down the street under a banner singing it. Okay, so finish off. Top quality stats are essential, I think. COVID's just shown that desperately. But it requires resources and careful coordination. This is just, the data does not speak for itself. And trustworthy communication is vital to all stakeholders. And that's the banner, I think, that we need to go under: trustworthy communication. And just some warnings, though, finally, to people who do want to stick their head up above the parapet and become engaged with the media. You can get some slightly bizarre things happening. This time last year, actually, it was exactly this time last year, on the same topic that we're discussing this year, will we have to close Christmas? I said that raised voices could spread the virus. Yes, they can, absolutely. And then, I said, well, maybe singing may be banned. And in fact, actually my choir just last week, we were singing outdoors, distancing. God, it's freezing cold, singing carols outside. And then I said, I thought I'd have a bit of fun. It might be a good idea to ban family arguments, because there's nothing worse than people in a small unventilated room shouting at each other across a Christmas dinner. And so this was a joke. But by an hour later, there in the Daily Express was the headline: Christmas warning, families could be banned from arguing to prevent COVID spread, according to a leading British statistician. I thought, yes, there's a bit of not exactly trustworthy communication, but a little bit of fun to be had in engaging with the media. Okay, so I'm going to stop there and stop sharing. And what have I gone? Timing's not bad. That's not bad. That's about what I wanted to do. And then I'm going to be told what to do now.
Please unmute, Gary.
See, that's a problem. I was just demonstrate all the problems can happen when into the room. Just to repeat what you said, but I was just saying that thank you, David, for not only the fascinating talk as always, but for all your effort to improve the trustworthiness of the communication. I think that's absolutely crucial. I certainly got lots of questions of my own, but there are quite a bit of questions online. I'm going to read some of them, and we'll also open up questions for others if you haven't had a chance to to type your questions. Let me start with more or less as the question came in as you were giving the talk. The first one was which category saw a reduction of deaths? Car accident, similar things. Those could theoretically kept low without locking people up. I think this is referring to your young people.
Yeah. No, I mean, I think the main ones I did mention is that the main sort of collateral, we might call collateral benefits rather than collateral harms, were certainly in flu. I mean, that'd be the biggest influence. All the distancing we've got, and the fact that people were isolating when they had some symptoms, respiratory diseases, whatever, just stopped flu. And this winter it's working as well. So, and car accidents were down, of course, we could think, and I said violence in young people, was down, but some domestic violence was up. All sorts of things have changed. But I think the one that we could learn from is flu, is that the fact that in the UK 10 to 20,000 people were dying of flu every winter, and huge numbers in the US as well. That could be reduced substantially by maybe just taking some basic precautions about distancing, particularly if you've got any symptoms at all. So I kind of think that, well, who knows what the future holds, but all the measures that we're taking at the moment are a benefit for all respiratory diseases over the winter. And that might be almost a long-term benefit of this pandemic. Yeah.
Just a quick follow-up on that from my own, that do you think that possibly there's also kind of a competing risk issue here, because people suffer both flus and COVID, maybe most like coded now as COVID instead of flu deaths, right? Because there are these issues how hospitals now attribute the deaths.
No, I think that is often argued about, and it comes into on the death certification about whether people are dying with something or whether they're dying of it. Because of it, and as I said, in 90% of deaths with COVID, it's the underlying cause. It is put down on the death certificate. We know that flu is actually quite rarely put down as the underlying cause on death certificates, so you can't really use those as a measure. Now, I think that's if there is substitute. That's why we have to look at excess deaths. I think and look at substitution. Whether people who would have died of flu are dying of COVID, that is quite possible, because it is similar people. These are all older people, more vulnerable, and so on. It doesn't mean that exactly the same person would have died of flu,
sure,
but in a sense they are competing risk for the same population of people. Yeah, but I don't think that means somehow that COVID doesn't matter.
Sure. Yeah. The next question is from a colleague of mine, Harv here. Said, my observation on data graphics in newspapers like Guardian and the New York Times is that they have generally gotten much better in recent years, but they still do a poor job of communicating the uncertainty in the central tendency they depict. What do you think this is, and how can it be improved?
Yeah, I think that is a problem. I think it can be improved by actually trying to make sure that the uncertainty is on the graph that they're often copying. For example, the ones I showed on the infection survey, with the credible intervals marked in. But even then, they might be taken out by the paper because they kind of feel this is too complicated to explain to people. But you're absolutely right. They tend not to be used. Now, I could say that unless it matters, that really might not matter too much. The fact that because they want to keep the graph simple. The fact that they are using line graphs in newspapers and on the media is a positive development, because they've been very reluctant to use them in the past. So I'd say that I don't feel too strongly about having the uncertainty on the media graphs unless it is absolutely crucial to the issue. In other words, if the uncertainty bands cover an important point, like zero difference. So if they're talking about a change and yet the uncertainty bands cover zero, that would be outrageous not to use them. And I think that obviously is an issue. A lot of it, I think, is because they haven't developed the language. They haven't got a format that they're confident about using. And I do think that could be improved. Yeah.
Thank you, David. Next question is the one regarding what you said about the Brazil president, and I'm going to phrase it a little bit more broadly. Essentially, how can we scientists and journalists can compact this kind of affirmation from politicians over vaccine or deaths or other issues? Is there any strategy to not give those people and the followers views and clarify lots of issues, because it's a hard one, right? Because politicians always, or not necessarily politicians, most people, like when they make argument, they use the best argument for themselves, use the worst statistic for their opponent, and the question then is how as the consumers ourselves to help the situation better understand it, but also reduce that kind of tendency.
Okay, well, I got quite strong views about this. I think the wrong way to do it is for scientists to become themselves to become advocates of policies. And there are a lot of scientists in the UK and elsewhere who have very strong views about what should be done and are very vocal about them on the media and on Twitter and so on. I think that's the wrong approach. Basically, because I think that it's fine if they want to be advocates on their personal basis, but to use their scientific credentials and all their job to do that, I think it's grossly inappropriate. Actually, it just goes against, I think, the what they should be, what's appropriate to do. So I think the first thing is to be trustworthy. And the trustworthy means admitting which is your domain of interest and sticking within what is your domain of interest and trying to raise the level of the discourse, trying to improve what's being said. And that means not being an advocate for what you personally feel should be done. But it does, but it doesn't just mean saying, oh, well, being a bit sort of soft about it, because as I said, you can get in there really hard about, okay, I am uncertain, I don't know everything, but I do know that this is wrong and this is misinformation. And you can go in really hard and have a really committed, compelling argument about what is actually wrong. When it comes to what people should do, that's not your job. And when it comes to, but it is your job to try to raise the level of understanding, I think, and being a source, a trusted source, if possible. But the crucial thing is to be trustworthy. And in fact, it's worked. Trust in scientists in the UK has held up extremely well. But I think they should keep off platforms with politicians. They shouldn't be appearing with politicians, or maybe one or two very senior advisors can, but the rest should not. They should keep separate and do their own communication and have that independence. But that requires science sort of being quite tough with itself and realizing its limitations, what it can say. Yeah.
That's a terrific answer. I, again, will plug in there a series of articles in Harvard Data Science Review, essentially kind of discuss this point, because you definitely hear different perspectives. In fact, there were questions whether data science, as part of the science, should be neutral or should be value driven. And there are these issues being discussed, and you can see how these topics can, even very well intended one, can be used as, for political reasons.
Absolutely.
And I think we all understand these days how data science themselves being used by all parties to advance their own agendas. So.
And I'm not naive enough to think there's such a thing as scientific objectivity and we can completely separate our own motivations. That's impossible. I know I'm motivated by many feelings and judgments. You can't take judgment and personal that personal input out of it. But you can, I think, strive not to be trying to persuade somebody of something. Because frankly, you're not being trustworthy. And
I mean, you're absolutely right. I think the point here is really trustworthiness. If you've done a few times, people know how you were driven to present these results, then they will discredit whatever you said.
If you're a particular selecting data, if you're just you picking up the bits of data that suit your argument, I mean, why should anyone listen to you? Why should they take you seriously, whoever you are? If a politician might do it, but for a data scientist to do it, I think is unacceptable.
Right. Thank you. Let's move on to really many other questions here. Now we have 21 of them, and you're certainly inspiring a lot of questions. We were trying to get to as many as as possible. Here is a comment which I think are probably worth mentioned regarding the death rates among the vaccinated higher. The point here is folks who are sicker to begin with would be more likely to seek out vaccination. Yeah. They'll be more likely to die without vaccinations. Of non-vax, my belief is that the healthy groups would have a lower death rate just from being healthier and have nothing to do with the vaccine status. Yeah. Then there's a denominator issues, as you mentioned. It's one.
Yeah, absolutely right. Even if you fix the denominator issue, you couldn't imply vaccine effectiveness from those simple bits of data, because having a vaccine is a choice that you take, and vaccine effectiveness estimates must come from proper studies, test negative control studies or something where you're matching for people for in many ways to work out about the effectiveness of the vaccine. So I think but it's while you could never infer vaccine effectiveness, to get something to put something out that gives you completely the wrong picture, I think is really culpable. Yeah.
Thank you.
Good point. Good point.
Yep. Next one that from audience say, thank you. I would love to hear Dr. Spiegelhalter's thoughts on similarities and the differences inherent in pre-bunking misinformation and the communicating uncertainty and the limits of statistics.
Yeah, that's great. That's such a good question, because I think there are, as I said, we list those all together as points, but we do kind of distinguish them, because one is talking about the inadequacies of what we know, the limitations of what we know, and that's just having that humility and honesty to admit what we don't know. But as I said, there are things we do know, and we do know that this is false information. And we shouldn't hold back from that. I've been very strongly influenced by, and I think I had that by this guy, John Krebs, who developed this whole strategy in times of crisis for communicating with the public. And he was doing with foot and mouth disease and everything. And he just said, first of all, say what you do know, really hard, what we do know. And then admit what we don't know. And then say we're doing something about it, we're learning. And in the meantime, this is what you can do. But we will come back to you and things will change. Our advice will change. Such a great process, because it warns people that things will change. This isn't just fixed in stone. So you can admit certain things. People are still reluctant to admit that all this wiping of surfaces is pretty well a waste of time about stopping COVID. But there's people are still doing it a year and a half later. So nobody really ever wants to admit or change their opinion, because they were so stuck with that opinion in the first place. So I think that that's a very good guidance. And so the countering misinformation and the pre-bunking is the idea that you not only say this is misinformation, but you get in there perhaps even before people have heard it.
I see.
So they've been warned, they've been inoculated against the misinformation. Oh, well, and you say, do you know there's people going around saying this, and this is why it's wrong? And then when they do hear it, oh, I know this isn't right. And my colleague Sander van der Linden has done some really good research on this, empirical research showing this can be an effective strategy of getting there early. I mean, it doesn't always work. I mean, we were some of the first to identify that most deaths were among vaccinated people. And we wrote a whole article about it, and we got an enormous amount of criticism, and we became part of the false information stuff. People were tweeting our headline saying this shows vaccines don't work. So, oh God, no. So it can go, I don't know. I still think it was the right thing to do, but maybe we could have done it better. Yeah.
Well, there's always improvement can be made.
Yeah.
Another one from another colleague here that love the talk. Thank you. What do you think we can do better in visualizing COVID data for the public? There seems to be a regression to the mean regarding the type of visualization we see. I love your example. Do we need more novel ways of showing data? Are existing methods, e.g. line and the bar charts, perfectly sufficient?
Yeah, I think it's a very good question, because one could think of all sorts of clever ways. But actually, I think for the public, having something that's the same, that's regular, they can learn how to look at it, that's always the same, and is actually, telling a pretty simple story, is very important. That you're not trying to continually change things and make things more sophisticated, even if we might like those. So I think that there's fixing on some tried and tested designs is very effective. But as I said, what I like about, there's been some awful examples, but what I like about the ONS ones are things like having the explanation on the graph, the pointing out little quirks, things that you might be misled by, and having having the main summary message in the graph itself, inseparable from it, not in some text. So you can't, if you copy the image, you get the whole story with the image. So I think there's some really important lessons on that of how not telling people everything about the graph, but trying to make sure that the main message is as clear as possible. And that's I think some of the important lessons we can gain, how important improvements we can make in improve people, help people to understand what's going on.
Thank you. Let's turn the question to a couple of them about UK. Here's the one. In the US, there are some key statistical sites that are trustworthy, for example, Johns Hopkins. But each state reports their own way and vary widely. Is it similar in the UK or is the reporting centralized?
Well, it's a bit of a mess in the UK, to be exact, because we got 4 nations in the UK. We've got England, Scotland, Wales, and Northern Ireland. And if you go onto our dashboard, you can see everything by the 4 nations. And up till last summer, August, September 2020, they were using different definitions for what a COVID death was. So, it's an absolute shambles. Now at least they've pretty well agreed on definitions, but they've all got different policies about COVID, the 4 nations. They operate independently. And so it is complicated. It does make it complicated. I tend to use England, is the biggest ones. So all their statistics do tend to be pretty reliable, and Scottish statistics are particularly good. They've got a very strong reputation, but they are different. They collect different stuff. There's some things, Scotland, if I want to get a cross tabulation of how many people have died, whether they died of COVID or not, and what they died of, COVID and other causes by excess on a weekly basis, and by place of death, where that death was. I have to go to Scottish data. I don't get that from the English data every week. So that's pretty important. Yeah, no, it is different. And it is, it's one of the things the Royal Statistical Society has said, please, can we try to sort this out in the future? Because, we are still one country so far. And so let's bit iffy, but let's, and 4 nations, they've got a lot of independence to do different things, but let's at least try to get the statistics sorted.
Thank you. Here's another one regarding UK government, and it's to your point about using the wrong, population number. If the UK government had used the smaller population numbers, wouldn't that have left it open to criticism by anti-vaxxer to have changed the methodology to continue and alarmist the message? It seems it was a no-win situation, even with an explanation.
Absolutely brilliant. Yes, exactly. And that's why the agency didn't want to change their method, because they thought they might be accused of shifting the goalposts. And so that was their reasoning given. We all look like we're changing things. Okay, I don't think that's an excuse. Not when you're doing something that is so misrepresents what's going on. So an alternative is, of course, to do both. You just extend the methodology. And I think that would have been ideal, rather than suddenly shifting. At least do both. And better perhaps than not doing it at all. So I just think they should have done both. And I think that gets around that argument.
At least also, there's a right thing to do, even just from the idea of expressing uncertainty, right? Because you have an uncertainty that, so even for that purpose, that's good.
And it's an interesting
good practice. Yeah.
It's an interesting form of uncertainty, because it's to do with systematic biases rather than the idea of sampling uncertainty. And that's always, I think, a trouble that statistics has, is with expressing uncertainty due to systematic biases. And it's going to be an increasing problem as data statistics moves away from surveys towards administrative data.
Here is another interesting one. What are your thoughts on communicating wrong things and then explaining why they're wrong as a means to get ahead of misconstrued narrative? Or in your opinion, is it better to try and now show misleading graphics at all and not show misleading graphics at all?
Yeah, that is a real problem. And one of the things, you got to be careful when you do anything in Twitter is not to retweet the horrible thing, because it just makes it go even more viral. And so there is a strong issue there about not promoting the misinformation. And I think we might have done that with our vaccine article we actually ended up contributing to the spread of misinformation through identifying it and in a way advertising it. So I think it's quite difficult. At the same time, you can't just let things go. And obviously it's best to try to prevent it at source by improving the communication, but you can't always do that. There will be a lot of false data just circulating all the time. So it is a tricky balance, because you don't want to promote the very ideas that you're trying to counter. But I think in the end, you do have to, try to correct it and try to point out why it's wrong. And that means giving it some profile. And I think you do have to do it. You can't ignore it. Now, the point is, though, it depends, who's your audience. There are some people you're never going to convince. They're deep skeptics about anything. They're deeply untrusting of all authority, and particularly statisticians and people like that. And I get a fair amount of abuse from people like that, and which I don't even bother to try to counter. But there's a whole intermediate group of people. You can break them up into different, or segment the population into a group that, well, they're a bit hesitant, and they don't want to believe everything the government's saying. They're really quite skeptical about the government. At the same time, they might be hearing all sorts of things on social media, and it's that group of people that you really want to try to get to, and to say, no, hang on, just be careful of this. Just be careful of this. So there's no single message, and there's certainly no answer to how to do. I've just recorded a podcast on dealing with misinformation on social media, and there's no simple answer to it at all, except I do feel that statisticians and data scientists have a particular responsibility to try to ensure that their data in particular doesn't contribute to it.
Thank you. I'm having a hard time because there's so many great questions. So I'm trying to do my best to be selective a little bit. And I hope that if we can have a little bit more time, we might get to more of those. Let me go to the next question. That is there a mechanism to deter untrustworthy communicators from misusing the work of trustworthy statisticians? This is particularly as pertains to the large media organizations.
Well, there are, media regulators. And I threaten complaints to them a lot. I just yesterday, I was so angry because I gave an interview on Sky News in which I said, just that we don't know what's going to happen with Omicron, but the government may need to introduce some more stringent measures after Christmas. And the Times wrote an online article saying, Professor Sir David Spiegelhalter urges the government to introduce more stringent measures. I said, what? That's completely against my reputation and what I try to do. I was furious. So I wrote to journalists immediately threatening them with the regulator, which is quite a serious thing. I just go straight in and threaten them, with the press regulator, and they changed it immediately. But and it was very apologetic. It was a sub-editor who wrote it, So I think you have to go in hard against misuse, against media organizations when you can, and use all the tools you can to try to stop them to do it, because it's terrible if professionals are doing a decent job and then find their work being distorted. And as I said, it's happened to us, it happens to many people. And so I think you have to use all the tools at your disposal to try to counter that, all the influences you can, including legal ones if necessary.
Yeah, one of the issues there is media particularly always like to report things particularly alarming or particularly kind of extreme. That's kind of the nature of that. And so this is one of the perspective from, again, one of my colleagues here say, we see a great deal of speculation about the Omicron. And in addition to urging scientists to avoid political forums, perhaps we should be more clear that speculation with so little data is not helpful, but it can be harmful. Well, I've learned.
I just know, and I thought I'd learned to deal with if you go on a media interview, they want you to speculate and they want you to blame. That's the two things. And I thought I'd learn to counter that and not to give in spite of the questions coming in. Because unlike politicians, we don't have to answer questions. We can just say, no, I don't know. That's not what I do. We can, next question, please, and make a joke out of it. And I thought I'd got quite good at it, but I have failed, now on the Omicron by, just letting myself suggest one possible future of what might happen. And even that, and that's immediately what they pick on. So I thought I'd learned how to do this, but you need constant vigilance of thinking of that this is not a conversation, that you have to be unbelievably careful about any contingent or possible thing, because that's what they'll pick on. It is a problem with Omicron because there's very little data to go on, when you're trying to explain the data. So I hope that things will get better when there is some data around. But very difficult.
Thank you. I'd like to get to quite a few questions really about preventing future spread or even future pandemic. And one of them said, thank you for your talk. What's the best sampling strategy to identify potential cases, not from the motivation of estimating a population infection, but identify the case and stop further transmission? Say upon landing, whom should the country test from the plane?
Oh, it's not what I do. So that's not what I do. I don't do testing strategies. I'm not a public health, infectious disease experts. So no, not going to answer. Okay. Next question.
Next question. There is another question that given the current trends on vaccination, infections, variant development, is it possible to forecast when COVID will move from pandemic to endemic? If so, do we already know?
No, not going to answer that either. Not what I do. I'm not a modeler. I'm not an infectious disease expert. Next question.
Okay.
Oh, we're getting through these. Cracking through these.
Well, then I think there are quite a few other similar questions, but I think that this one you have to answer. Do you use Bayesian language when interpreting findings?
Oh, that's very important. People may know. I've been a lifelong Bayesian statistician, and so yes, because I do think that every finding is on the basis of data and judgment, whether that judgment is about the model or the independence of the observations or whatever. So I will always interpret everything in terms of personal uncertainty. I never use the B word when I'm talking at all, and I never will also use the word confidence interval. So I'll always use, if I am talking about an interval, I'll use margin of error or uncertainty interval or something like that, or range or something like that. So I'll avoid discussing what exactly I mean by those, but implicit in any discussion that I do is the fact that these are constructed on the basis of data and judgment as well. Yeah. So I got that little Bayesian, sitting on my shoulder the whole time, but it doesn't. It keeps quiet. Doesn't reveal himself.
Okay, so here's the question. Push further on that. Insofar as your average citizen, at least American, knows about any statistics, they know about frequent statistics, and they know, in quote, that p less than 0.05 means choose, and vice versa. Should we be teaching more Bayes at the high school and early college level? Do you do so in the UK?
Some at college level, none in schools yet. No, I think the trouble with the Bayesian stuff is that it is more mathematical a lot of the time. It's really dependent on probability theory. Whereas in my Art of Stats book, I was copying the restructuring of the curriculum that promoted by Andrew Gelman and many others, where probability actually comes in quite late. And you do stats, you do a lot of statistical stuff without bringing in the mathematics of probability. And so, but then Bayesian stuff has to come after that, because it is, Bayesian statistics isn't statistics, it's applications of probability theory. So I think it is tricky to introduce it. And one can introduce basic ideas of it through, applied in diagnostic testing and so on, about the baseline, the importance of the baseline. There's so much of what I've been talking about today is in fact Bayesian. The seatbelt analogy and all that stuff is all to do with base rates and so on. So one can introduce a lot of those ideas, which I think is very valuable to do, and introduce Bayes' theorem, the idea of that, and difference between predictive value of a test and sensitivity and so on. So I think all those things can be introduced without, and should be introduced, obviously. But apart from that, as I said, the Bayesian bit I like is not even particularly Bayes' theorem. It's the idea that uncertainty is a personal judgment, and that is an expression of our lack of understanding, our lack of knowledge about the world, and that's what probability is. And I think that can be taught very early on to people, and to encourage them to think that any uncertainty statement on the basis of statistics always involves some judgment, always. The data does not tell you what an uncertainty interval or something. The calculation might, but in fact, using that particular calculation is itself a judgment. And as I said, in particular, it avoids all the systematic biases that might be present in the data. So those ideas, which are to do with in a way, the subjective element of statistical analysis, I think are absolutely crucial and should be part of teaching. But the mathematical side of Bayesian work is a bit tricky unless you've got quite a mathematically trained audience.
I see. Before we continue, I want to ask Kevin, how are you doing time-wise?
You can wrap whenever you would like.
Oh, these are such good questions.
Yes, well, let's continue. I mean, how about we just continue, and people they obviously feel free to leave, and I think there are a lot of good ones.
Yeah.
Let me touch on this one. That like some media outlets, some academic researchers may not be trustworthy, and they might publish some untrustworthy results, which in turn could be used by some media, trustworthy or not. What could trustworthy academia do about it?
That is such a good question, and it's very relevant. There's some stuff, there's work that's come out from, and I won't mention their names, but professors in a really good university in London have just put a paper up on preprint that is being massively circulated by anti-vaxxers, and is completely predictable, calling into question basis for vaccine data. And these people have, I think, been well, I'm trying to choose words that won't open me up to legal action, and have not been trustworthy in their communications and their use of their academic credentials, and they've aligned themselves with skeptical groups that have been positively harmful, I think. So there's a lot of academics who I think have not done to put it mildly, have not done their reputations very good. Very difficult what you can do about it. As another academic, you can criticize them on social media and things like that, I think, and call them out. But it is quite tricky. The whole thing about what happens when their papers get refereed and things like that. And it's very difficult. And what you think, I mean, you can, of course, and I know people have done this, complain to their university authorities about them, and actually start campaigns against specific academics misusing their position to spread misinformation. And I think actually, yep, that's quite reasonable. Then the academic institutions, it's their responsibility, just like for accusations about papers and retractions and things like that. It's the responsibility of the academic institution to do something about it. So I think it's quite reasonable to complain to academic institutions about the practice of some of their employees.
Thank you. David, here is a critical one. Okay. In the AstraZeneca benefit harm graphics that had widespread success, you selected one harm. Yeah. Can you explain the process employed to decide on using that one to stand alone?
Yeah, no, that's very important. That was the one that's in the news, these particular blood clots. Because there are other harms to vaccines, there are short-term harms to vaccines, which we can put some numbers on. There wasn't anything else at the time that we had some specific data on. Obviously, there's huge numbers of adverse reactions get reported, but there was nothing that had been causally attributed to the vaccines that we could put numbers on. As I said, in subsequent version, we added in, benefits that are not present in this graph include blah, blah, blah. We also put in harms that are not included include blah, 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 and added in a list of other things that we weren't including. But at that point, that was the one harm that really had been causally linked to the vaccines. Now, well, for Pfizer and Moderna, we got the myocarditis and things like that, which we'd have to include for those vaccines. So I think, again, I wish we had even in that early graphic, included its limitations as part of the graphic. That's the lesson I've really got to. put the main interpretation in the title and include the limitations as part of the graphic, the warning. Get the caveats in the graphic. Don't not buried down somewhere where they get lost. Get the caveats in the graphic.
Thank you, David. Here is the one that actually has 3 parts, at least 2 parts we already kind of touched upon, but the third part we have not. It said, David, thank you for sharing your wonderful insights. 1, could you please touch on how information used selectively for political purpose, that is to create certain narratives, versus honest mistake in sharing data? 2, what are some of the best ways of presenting data to communicate to general mass? 3rd, could you touch on the trustworthiness of data from other countries globally? For example, India, China, Brazil.
Oh my God. That's really trying to get me into trouble, isn't it? I got to be careful. I got to be careful now. Yeah, let me just find those questions there. Or has it disappeared? I was reading that in.
Oh yeah, because I think Kevin took that away. But the first part is about political, selective use by politicians. Second part is the effective
what's good ways
skills
of doing it.
Right.
Yeah.
And the third one is really commenting on trustworthy data from other countries.
The selective use by politicians, again, very difficult to stop them, but that's something which makes me very proud to be part of our Office for Statistics Regulation, to have an independent statistics regulator that can criticize publicly politicians for their use of statistics. I think is a fantastic innovation. So the crucial thing is the independence of the national statistical system, which we were fortunate enough in the UK to have in our legislation not that long ago, 2007. Before that, it was under the Treasury. It had a minister who was in charge of the statistics. Now, the national statistics in the UK does not come under a minister, it comes under Parliament. And this is incredibly important because you do need an official way to, in a way, criticize government use of statistics, and not just through the media. And you need a strong body to do that. It's got to be quite careful because in the end, the government is paying them. So it's got to be quite political and diplomatic about what it does. Okay, second part, how do you communicate to the masses? Wow, first of all, there's no correct way of communicating. This is what I've learned from my psychologist colleagues. There's no correct way to communicate anything. You have to decide who your audience is and what you're trying to do, what you're trying to achieve. And then you design something and then you test whether you've done it or not. This is all from Barak Fishoff from Carnegie Mellon. It's fantastic insight into risk communication. So I've stolen everything from him. And which means that you are open to do almost anything. As provided that you do test its effect. You want to know whether you've achieved what you're trying to achieve. If you're trying to persuade people to buy a product or to click on a particular link, obviously you design things to push them that way. If, however, you're trying to design something that is genuinely trying to inform people and improve their understanding, then you check whether it's improved their understanding. My personal feeling is, as I said, is to keep to fairly simple graphics. Big argument about whether we should use log scales or not in big public communications. God, it's been going backwards and forwards for 18 months now about whether log scales should be used or not. So it is quite tricky to think of how we can keep things simple and yet get the message over. But so my crucial thing is there's no correct way, but try things. And of course, and don't use pie charts. So that's the one thing. The one thing I would say: never use a pie chart. Yeah. What was the final one? There was
the final one is: can you comment on the trustworthiness of data globally from other countries?
Oh God!
India, China, Brazil.
No. That's getting a bit delicate. All I can say is that when I look at COVID, the impact of COVID on a nation, I don't look at in many places, I don't look at how many COVID deaths have been reported. I look at excess deaths. And that would hold in India and Russia and Brazil and many, many other countries as well.
Okay. A few more questions, and some of them I'm skipping because they're about how to collect the data. I know you said you don't want to answer those, but here's the one: that how can you be trustworthy when you don't trust the basis of your stats?
Oh, well, you have to be upfront about that. You have to admit the limitations, the poor quality evidence that you've got. We wrote this article a couple of weeks ago about meta-analysis on face masks and on ivermectin, and how people had done this meta-analysis, but they'd put together data that just very poor quality studies. And you can't, just by putting a whole lot of stuff like that together, you can't suddenly come out with a good answer. And so you just got to be upfront. Sorry, the data isn't good enough, and I'm not going to say anything. I'm not just not going to make a claim about what the exact effectiveness of face masks is. We don't know. We can make some judgment perhaps. So you have to be honest about the limitations in your basic, what you've got, your basic clay that you've got to make some judgment out of.
Thank you. And here's a not unrelated question. How do you make neutral of your domain to collect trustworthy data? I think that the idea here is like whatever it's your domain. You obviously enthusiastic about. You obviously has invested interest in it. How do you, present it in a way that people feel you're not just trying to persuade them?
Oh, I see. Yes, yeah.
What you're interested in.
Well, I think well, the interesting that it's those 5 things that we think that you have to be honest. You have to be have some humility and honesty, and you've got to be open. You've got to you almost got to expose yourself to potential criticism, and which you have to open yourself up by admitting what we don't know and the limitations of our knowledge. But we do know some things. So it's that rather than trying to sort of argue somebody into position, you actually are the vulnerable party. You have made your arguments accessible so people can check your working. You've been transparent about your reasoning, and that takes some courage, I think, and boldness, and it needs institutional support as well, because it does mean that people will be able to criticize you. But I think it's the right thing to do from an ethical point of view, which is what Honora Neal would say. It's your duty to do it. And our research so far suggests that it's effective. Oh, we're doing some fantastic research of randomizing different ways of presenting data on vaccines and on nuclear power to audiences. And one way is persuasive, and the other is balanced and obeys our laws. And then seeing what the effect is on their trust in the source and then looking at it by different groups of people. And the data that looks fantastic is that, and it's a subgroup effect. Overall, it doesn't have a huge effect. But in the group of people that were very skeptical about vaccines or skeptical about nuclear power, it increased the trust in the source of the information. Didn't necessarily change their minds, but that's not the point, to change their minds. But by being trustworthy, you can gain the trust of skeptical audiences is what we would hope for, and that's what we found so far. I mean, we believe that you should be trustworthy in it's an end in its own right. But actually, if it does make skeptics trust the source more, that's a good thing, because it means they're going to be more engaged with the discussion. Doesn't mean you'll persuade them, because you're not trying to persuade them. So this is really exciting, and this idea that modes of communication is an empirical science in terms of graphs, of language, of balance, is such an exciting. I'm just learning about this with my colleagues. It is really exciting. Very important.
Thank you so much, David. I noticed that we already passed the 1:30. I think we need to wrap up. I'm really pleased that we still have 50% audience there, but I can't resist to ask the last question, given this is a celebration of the 5 years of Harvard Data Science Initiative. So here is a perfect question to end this fascinating conversation, as well as your wonderful answers. And I thank the audience for all the terrific questions. The last question I'm going to ask is, have there been any important data science techniques that you have found to be important through your analysis of COVID data during this pandemic?
Oh, goodness. Well, no, I'm the wrong person to ask. I haven't been doing any fancy analysis at all. I've not been involved in data analysis. It's all communication that I do. So I'm afraid it's the wrong person. But there have been there's some really cool stuff being done in terms of modeling that's been done, and it's been almost all Bayesian modeling that's been done. And I think that it's the link that's grown between official statisticians and really cool academic departments coming together using the best modeling techniques and some really exciting data. And they've had to turn around these analyses in days and it's gone straight onto the Prime Minister's desk. I mean, you know, all this Bayesian analysis. Isn't that exciting? You know, it's quite extraordinary how things have come along, really. Yeah.
Right.
Really
Well,
exciting.
thank you, David. I think that you're being very modest because, you know, here when we talk about data science, it's a very broad, it's including all the randomization. You're talking about data collections, everything's there. I think most times that by the time you worry about analysis, it's too late. As you know, I think that what we talk about today is really that you mentioned all these, you know, data issues, that it's like really both ends are probably more important than middle. One is how the data was collected, conceived. In the end is how the results is communicated. And the analysis we tend to emphasize a lot, but that's only one part. And I think there are a lot more we talk about today. And I want to thank you again, sir, and for a wonderful conversation with all of us. And I want to thank the audience for your participation and for staying for like over 90 minutes. And I still have a lot more questions here. And I think, David, probably you will welcome them to email you in some form.
And
thanks to the Harvard Data Science Initiative for having this event, and congratulations for its 5 years, great, you know, forming years. So thank you to all.
Thank you so much, Sally. This was wonderful. Really, thank you so much for letting me join in this event.
Thank you. Bye-bye, everyone.
Bye.